With COVID, the Nigerian healthcare system has been shown to be in need of strengthening as the pandemic reveals its true state. This report conducted on Apete Primary Healthcare Centre has highlighted some of the things the government at all levels need to address to strengthen the health sector. Apete Primary Healthcare Centre, situated in Apete Community, a suburb in Ibadan City, Oyo State, Nigeria, hosts a population of about 103,261 people, according to the 2006 census, which has evolved from an agrarian community into a commercial hub. The Apete Primary Healthcare Centre caters for about 1,000 people's healthcare needs on a monthly basis. The advent of COVID-19 pandemic has heightened the clamor for repositioning of the health sector in Nigeria as the virus brought to the fore decadence in the healthcare system. According to the community report, impact of COVID and state of the primary healthcare survey conducted by Ibukun Emiola in September 2020 for more than 50 community members at Apete, a greater percentage of respondents want to see more intervention from the government to build infrastructure and provide healthcare facilities. The community report impact of COVID and state of primary healthcare survey has more than 73.68% female respondents and 26.32% males in Apete Community on the state of their primary healthcare center. Government's intervention to strengthening the sector in the face of COVID-19 and the impact of COVID-19 on them. Dr. Babatunde Olatunji, the Executive Secretary, Oyo State Primary Healthcare Board, said on COVID-19, the federal government supported COVID-19 response at the local government areas level with more than 40 million naira. Olatunji further said the fund was used for training of frontline healthcare providers on infection prevention control.
PHC has been able to come on very strongly by getting support and being strengthened for contact tracing, community mobilization activities, awareness creation in the nooks and crannies of the state, and for healthcare providers as well. Government was able to organize training for them so that, this is a novel virus, and everybody needs to update their knowledge on what and what needs to be known about the virus and what and what needs to be done in preventing oneself and protecting oneself and be able to render expected services. So training was organized about in different series.
But according to the survey, 77.19% of respondents said the state of the healthcare sector in Apete Community is bad, while 54.39% stated that government's intervention on COVID-19 is inadequate considering the amount of deficits in the country's health sector, while 19.3% respondents said they are not aware of any government intervention in the sector, as said in the national dailies about governments repositioning the health sector as to meet its shortfalls made evident by COVID-19 pandemic. Others, Professor Innocent Uja, the President, Nigerian Medical Association, and the Oyo State Chairman of the Association, Dr. Ayotunde Fasumba, as well as some patients interviewed at Apete Primary Healthcare Centre, also identify the challenges in the Nigerian healthcare system, adding that the challenges are not peculiar to the primary healthcare centers only. We are well taken care of at this primary healthcare center. There have never been a time we were not attended to. We want the government to provide steady electricity supply or a generating set so that delivery of babies here will be safe. This primary health center is okay, and it is one of the centers residents love the most. We want the government to recruit more healthcare workers. We are being delayed unnecessarily each time we come here because of shortage of healthcare workers. We also need more supply of drugs and injections. However, Olatunji, while responding to government interventions to strengthen the primary healthcare centers across the state, said the present administration has commenced the renovation of 351 primary healthcare centers. He said this is in line with the envisioned World Health System to address the decades of rough and neglect in the sector.
Well, if you've been following the narrative in the states in the recent past with the comment of this administration now, we've been talking about healthcare service strengthening, primary care under one roof concept, the establishment of the primary care board, and the strengthening of the process, in line with the World Health System, on which foundation primary healthcare is rested upon. We have decided that in an attempt to bring up the envisioned principle of healthcare World Health System, that is one functional healthcare facility per ward, the government has decided to renovate at least 351 healthcare facilities on the first line to among the list of facilities that we have. So this will be a model for each of the ward. At least each ward will be able to have a functional, not just functional, a qualitative healthcare service provision in such ward. But the fact that we identify or recognize that there are challenges in the healthcare system, the primary care has suffered neglect and rot in more than 2 or 3 decades now. And now you want to just start repositioning the system and strengthening it, put innovation. So if you observe that, it's not unexpected in a system that suffered neglect for quite some time, but now there's now a new paradigm shift now, a new focus on health to be able to correct all those ones and then bring them to the expected level and standard.
Olatunji noted that the state is funding the renovation of PHCs and it will be completed before the end of the first term of Governor Seyi Makinde. The federal government has not come in. Speaking on federal government intervention on COVID-19, he said PHC has been able to come out very strongly and being strengthened for contact tracing, community mobilization activities, and for healthcare providers, as well as the government was able to organize training for them.
400 to 500 healthcare providers were trained on the first line. Then again, the government was able to procure appropriate personal protective equipment for the healthcare providers, then provide water for hand sanitation and hand hygiene. This culture was actually improved upon, and PPE were procured, distributed across the healthcare facilities. Then bills were procured, printed, posters were made so that it would be a kind of a continuous awareness creation for healthcare providers and even for people coming to health facilities.
On the ratio of doctors to patients, the Executive Secretary, PHC Oyo State, said it is not only doctors that are needed, but all other healthcare workers too are not enough to cater for the number of patients visiting hospitals or health centers all over Nigeria.
That's global in Nigerian context, and it's everywhere. It's abysmal. But like I said, we'll be able to do a kind of a document we refer to as the minimum service package. With that document, we're able to identify what's supposed to be the ideal. But there's a discussion now at the state level now to see how we can gradually close that gap and recruit more hands to fill the space. So, like I said, it's work in progress. The cup is half filled, not half empty. So we continue adding up to it to get to the point of envisioned glory.
The community report, Impact of COVID and State of the Primary Healthcare Survey, further buttresses the fact that health workers are not sufficient for teaming patients. The respondents, which represented 92.98%, agreed that health workers are not adequate. This work was produced as a result of grant provided by African Channel Reporting Project at the Journalism Department of the University of Witwatersrand. The opinion expressed and conclusion drawn are the author's own and do not represent those of the project.